Hello everyone. Today I'm going to speak to you about the syndrome, what is called as Sjogren's syndrome. I'm Dr. Chandrasekhar Ayas, a rheumatologist from Chennai Rheumatology and Immunology Center. What is this Sjogren's syndrome and why 23rd July is celebrated as Sjogren's Day? July 23rd is the day when Henrik Sjogren was born in 1882. He is the physician who described this entire entity, what we call as Sjogren syndrome, and I think it's apt to use his birthday of July 23rd as the day to propagate the information about the Sjogren syndrome. So hence July 23rd across the world is practiced as a Sjogren's Day, wherein we give a focus on educating the public as well as everyone about this little uncommon but a real troublesome disease called Sjogren syndrome. And what is this Sjogren syndrome? Sjogren syndrome is an autoimmune disorder where immune system starts damaging the salivary glands secreting tears over the eyes, and also sometimes causes other systemic manifestations, which otherwise we call it as a dry syndrome, or where you have a dry eye, dry mouth, dry throat, and sometimes the dry skin as a consequence of autoimmune disease, resulting in damage to the salivary gland and eyes. So who gets this disease? So most often it is a disease of women. It's not that men are spared. So if 8 to 10 women is suffering from Sjogren syndrome, one of the male may be suffering from Sjogren syndromes. So when do we get this? Normally this disease occurs at the age of 40 to 50, but of course no age is spared. We do see as young as 10 years, may see as late as 80 years. So it can occur at any age, but most commonly it sets in at 40 to 50 years. So what are the reasons why one gets Sjogren syndrome? Often we think it could be a genetic predisposition. So we call it as genetic predisposition, unlike an hereditary disease. In hereditary disease, invariably you get a disease if you carry that gene. But here these are all multifactorial diseases where gene which is susceptible to develop the disease is present. At the same time, you may have an environmental factor which could have triggered the disease. Most often we think it could be virus, it could be environmental pollution, which alters the immune system to attack the glands, and as a result of persisting inflammation in these gland structures like salivary gland, tears gland, they may result in the dry damage to those structure, which limits the production of the fluids in the form of saliva, when it comes to the mouth, in the form of tears when it comes to the eye, resulting in the dry mouth, because a moist mouth is a necessity for a healthy tooth. So also the moist eye, which is necessary for a good eyes, could result in what we otherwise consider as the dry eye or a dry mouth syndrome. So what are the symptoms? How do we pick these patients, or how an individual can understand or know about this problem? When he starts developing irritation in the eyes, persisting irritation of the eye, especially when you go out to the dry sun or when you are facing a harsh weather, your eye starts becoming very quickly dry and your eyes starts irritating. Eye may become reddish. The eyelids may stick around. When you get up in the morning, you feel that you have a crust in the eyes. So these are all the earliest symptoms where you start feeling irritation, or you may blinking may increase. These are the very early symptoms of dry eye, and when that is present, an ophthal check will help us to confirm that. The next other common symptom is the dry mouth and early onset of tooth decay or the badly maintained oral hygiene. So this occurs mainly because salivary glands gets damaged. When there is no saliva, the food doesn't dissolve into the fluid, and that results in the dry tongue, a fissury tongue, and sometimes the fungal infection on the tongue, and the tooth decay could be the way one can present with reference to Sjogren syndrome. So in addition, you may see the parotid glands on the sides of the cheek being swollen, which is usually can be irregular, or it may come periodic, or may come in episodic. Slowly they may fibrose to produce an enlarged salivary gland on either side. And other problems that you may see is a chronic dry cough, which is seen in 25%. Sometimes the lung may also be affected by interstitial lung disease. So you may have a stiff joints or a painful joints, what we call as polyarthritic presentation. Of course, dry eye and dry mouth are seen in more than 90% of the patient. You may see dry skin in 20 to 30% of the patient. Vaginal dryness could be sometimes cumbersome and may have fatigue, and few other extra gland manifestations may be present in the patient suffering from Sjogren syndromes. How do we diagnose? When you have a dry eye or a dry mouth, see an eye doctor. He may do for eye test to figure out how much of lacrimal secretion or a tear secretion is there. What we use a small strip which is put over the eyes, and we measure what is the amount of tear secretion which is there. When it is reduced, we consider the person to have a dry eye. Similarly, when there is less of saliva or a dry mouth or a dry tongue, we call it as reduced salivary secretion. There are varieties of tests in which we can look for or quantitating the saliva, and then we test for ANA. Usually it's positive in majority. Rheumatoid factor could also be positive. SSA-Rho or SSB-La antibody could be positive. They, along with the clinical symptoms, help us to make a diagnosis of Sjogren syndrome. In addition, as I said, we check for eyes. Objectively, one can check how much of tear secretion is there. One can objectively test how much of saliva is secreted. We sometimes do a biopsy, lip biopsy, which when is subjected to histopathological features may help us in identifying the Sjogren's syndrome. So when you have a Sjogren syndrome, what should I do? How do we treat it? Number one, we need to care for eyes, because one of the organ which can get damaged is the eyes. So you need to put regular tears, eye drops, usually made of artificial tears, or sometimes cyclosporin drops. Sometimes we may do cautery or block these drainage of the tears, and some serum tears are also available. They help in maintaining the eye moisture. Similarly, you should care for mouth, have a good dental hygiene, maintain adequate hydrations using chewing gums, etc. One can keep the eye teeth cleaner. Stimulations of saliva using pilocarpine and sivamylin may help us. If there are repeated fungal infections in and around the mouth, one can use antifungal prophylaxis to treat it. When there is a systemic features, we use disease-modifying drugs. More or less what we use in rheumatoid arthritis can be used, like methotrexate, hydroxychloroquine, leflunomide. If there are complications like vasculitis or a kidney involvement, one can use mycophenolate, cyclophosphamide, azathioprine, and in an unusual serious conditions, we do use biologics like rituximab. So one of the major disadvantage or a problem we have is there is a delay in reaching to diagnosis and to the appropriate care. Mainly because of the overlapping symptoms, you have a very vague dry eye, dry mouth, caries of teeth, and you have a vague dry skin and itching, which may confuse when making the diagnosis. That could delay in reaching an appropriate diagnosis and the treatment. So when you have Sjogren syndrome, never be afraid. See, one of the few cool things are stay hydrated and informed about it. Always carry your water bottle. Drink water enough and chew while chewing or speaking, and visit your rheumatologist on a regular basis to identify if any other problems. Avoid both nicotine and alcohol. That can help in maintaining overall good health even though you're suffering from Sjogren syndrome. You remember, you're not alone. There are many who are suffering from Sjogren syndrome, and also try to partner your professional rheumatologist and his team so that they can help you in the way through the journeys of Sjogren syndrome. And there are many societies which are available called Sjogren's Foundation, including few of the Sjogren's associated patient health self-help groups are available. Reach out to them and speak to them, and also speak to the experts and your fellow patients. That helps you to fight and work with Sjogren syndrome. So it's not that that once you have a diagnosis of Sjogren syndrome, you need to be afraid of it. You need to take care, and a rheumatologist and our team at Chandra Rheumatology, along with ophthalmologists, dentists, etc., will help you in partnering and working you through through the journey of Sjogren syndromes. Thank you very much.